Joining me today on this local Rogers update is the Warden of Dufferin-County, Darren. Thank you so much for taking the time to speak with us today.
No problem, Tina. Great to be here. Thank you.
So let's talk about, as Warden of Dufferin-County, can you tell us a little bit about what you oversee for the county?
Sure. Well, I'm the senior member of County Council. I represent County Council like the mayor of a municipality would. I'm considered the chief executive officer of County Council. So my job essentially is to oversee all of the programs, everything that happens, run the council meetings, try to facilitate new programs, different things that happen, and make sure there's checks and balances in place for those things. When people say the buck stops here, I'm generally the guy the buck stops with. And sometimes it starts with me as well.
And how has COVID-19 affected the services that are normally supplied by Dufferin County?
Well, we've had to change in many different ways, not the least of which is our workforce. We've had to change a number of things around the way we deliver long-term care services. We've moved away from part-time workers to more full-time, dedicated folks. And if you're following sort of the COVID-19 thing across the province, that has been a challenge for everybody. I mean, a lot of long-term care workers, particularly public PSWs, work multiple jobs. And that's sort of been the evolution of long-term care over the years. And it's also one of the problems in long-term care right now is that so many people work multiple jobs trying to make ends meet. And it has contributed to the proliferation of COVID-19 across the province. So that's one way. Our office staff as well, we've had to transform from a bureaucratic office setting where everybody works in offices and cubicles close to each other to a workforce where a lot of people are working from home and doing different roles and different things. We've had to do that very quickly. And we've done it, I think, very well for a municipality of our size with our number of employees. It's changed the way we do road work. It's changed the way we pick up garbage. It's changed just about every aspect of how the operations within the county run.
That is definitely a lot. And so let's talk about the current status of what's happening with the long-term care facilities in Dufferin County. Could you give us an update?
Yep. I can't speak much to the private ones. I do know that there's currently no outbreak in Avalon. In the county of Dufferin home, the Dufferin Oaks long-term care home up in Shelburne, we are so glad that right now we've just come out of outbreak last week, which means we have no new cases, no cases active in the facility right now. And that's a credit to the fantastic staff we have up there. We have excellent nurses, medical staff, PSWs, maintenance, management. Everybody up there has worked very, very hard to make sure we had a very small outbreak when compared to a lot of other homes, even locally and across the province. The Shelburne residents, unfortunately, didn't fare as well, but with the help of the County of Dufferin, Headwaters Healthcare Center, and some other organizations, I think we've sort of managed to get them sort of back on track, and they're improving quickly. So we hope that we'll have a very positive result out of that home as well very soon.
Yeah, we all hope so as well, and we thank everyone and all the frontline workers that are helping to make all of this happen and to keep our community safe for sure.
For sure. If anybody had any doubt of how important nurses, doctors, personal support workers and whatnot, ambulance drivers, even grocery store clerks were before this all started, they have no doubt about their importance right now.
Absolutely. And when we talk about the Headwaters healthcare system, I mean, there's everyone there that's providing food, providing cleaning services, doing all of that. We've got, tradespeople out there working to keep things working and keep people safe. And we thank each and every one of you. Absolutely. So with the most current announcement about the slow opening of the economy, some of the parks opening, that sort of thing, as well as the good weather, are there concerns that people are not going to be following the protocols that are put in place?
Well, there are. And people are creatures of habit. So it's very difficult to change everybody's mentality on on how they behave interpersonally, or even hand hygiene, touching your face, wearing a mask, that kind of thing. It's very difficult to change that in a very short period of time. So it's understandable that people are going to be, either not paying attention to the rules intentionally or not intentionally. But it behooves us more to really enforce those things around social distancing, hand hygiene, and all of those different rules. We really need to buckle down. And now is the time when things are reopening again to reinforce those rules for sure.
Absolutely. It's very important that we still continue to take these protocols seriously. As a whole, Canada, we fared as well as I think we could have with everything that's going on. And in comparison to other countries across the world, we've done relatively well. So I think it's important that we reiterate and strive to keep these protocols in place so that we can continue moving forward.
Definitely is.
So with that in mind, is there contingency plans in place if we happen to have a second wave of COVID-19 and the coronavirus and what's happening right now?
Well, there are a lot of contingency plans in place, different areas of municipal government, different areas of the communities as well. We've done a lot of work, as have local groups like Headwaters, Communities in Action, the local food banks. All of those groups are really working together to adapt to changing circumstances. Within the county, we certainly expect that our workforce is going to remain remote workforce in the short term, probably even into the long term. We're having to adapt on a daily basis often and change things. So what we knew as normal, 2 months ago is no longer the way it is. This is the new normal, so to speak. And, we'll continue to adapt and put different protocols in place. That being said, most of the things around COVID and the medical aspect of this are going to be determined by public health organizations and hospitals and medical professionals. And we're going to take their advice and put programs in place accordingly.
Wonderful. And in the beginning of all this, the county took steps to prepare. We didn't know what to expect when all of this happened. And I will say you've done a wonderful job in keeping our communities and our businesses safe and healthy as much as we can in this fluid situation that's changing all of the time. Can you tell me a little bit about the procedures or the plans that have been put in place for recovery once we're on the other side of this?
Sure. We have a recovery team as part of our emergency operations center. We have a number of dedicated staff actually, who are dedicated strictly to recovery and planning for that. So they're rolling out plans right now. We're having different roundtables with different stakeholders, the agricultural business and different sectors within that to gather, input on what they need so we can approach different levels of government to try and facilitate those things. We've also started a rural resiliency task force as of last week in council, which is going to be a little bit more focused towards agriculture, ecotourism, and tourism in the area to specifically try to jumpstart those sectors back, because those sectors have been pretty hardly hit, particularly tourism, as everyone knows. But agriculture is suffering as well. There's a lot of challenges within agriculture. There has not been a lot of government assistance to agriculture as well. So there's a lot of struggles there. So those are some of the things that we're doing right now. We're gathering a lot of input, trying to put boots on the ground where they're needed. And we'll continue to do that with input from the folks that need it the most. We're not sitting back thinking that we have all the answers. I don't think anybody has all the answers right now. So every suggestion, every piece of information we can gather is helpful.
I agree. And I think just, all businesses, I think, and people that are out there, we all have different contingency plans for what may or may not happen, because we know that we don't know what's going to happen. So we have to have plans in place to do that. So could you tell us a little bit about the provincial support that the county has received and how that's been utilized?
So there have been a couple of different grants that have come out and one-time funding announcements. Most of those we've sort of directed both to long-term care in a bit, but mainly towards the community services, social housing kind of area. We've had a lot of challenges with additional.
Wonderful. So what, as a group, as a team for the County of Dufferin, what have you been doing to stay positive? Because I know you've probably been putting extra hours in. People are stressed, anxiety, and keeping that positive outlook on what's going to happen, that sort of thing. So what are you guys doing to remain positive?
Well, I'm spending time with my grandkids. I have grandkids that live here with me in the house, so I really sort of gotten into that. I see the light shine out of my grandkids on a daily basis. I also have dogs and a lot of work and a large honey-do list around the house that I'm trying to accomplish. So, and I think most people that I talk to are sort of along the same lines, trying to get things done, trying to stay busy in your little bubble, which sometimes can be a challenge. Now that some stores are opening, a little bit easier, but yeah. So just like that, but that's a good point that you raised, because people have to be cognizant of their mental health through this. And people need to know that it's okay to ask for help. It's okay to express that maybe you're not doing as well as you think you are or that you should be. And it's okay to ask for help, whether that's a neighbor, friend, family, the mayor, the warden, anybody. If you need help, just pick up the phone and give somebody a call, or a Zoom meeting. They're kind of handy too.
Absolutely. They are a great way for people to keep in touch and to spread information. So speaking to that, if people are looking for information about what's going on and what the most current updates are, where would they find that for the County of Dufferin?
Well, the County of Dufferin has our website at Dufferin-County.ca/COVID-19. You can get just about up to the minute information. It's updated a number of times a day with all kinds of information on government programs, other aid packages, mental health resources, community resources, etc. You can also look at Wellington, Dufferin, Guelph Public Health. They have a great website there as well. And for our business page, we have a business page called In Dufferin. That's sort of the County of Dufferin business resource. There's a lot of resources for business people and folks trying to get their business up and restarted and jump started on that site as well.
So just any last words of advice for the community out there and what we can expect coming for the near future?
Well, I just like to say to people, continue to heed the advice of the medical professionals. Listen to your public health professionals and your municipal leaders. We're not infallible, but we're doing the best job we can do with the information we have. It's important to maintain your social distancing. Wash your hands, wash your hands, wash your hands. And if you can't maintain social distance outside your house, put a mask on.
Absolutely. To everyone, stay in touch with each other, stay healthy and safe. I want to thank you very much, Warden, for joining us today.
Thank you for having me. It was great to be here.
Need help? Visit portage.ca.
Welcome to this Local Rogers update. I'm Tina Avery. Joining me right now is Kendra Mantler, the Coordinator, Community and Corporate Engagement Representative for the Headwaters Health Foundation. Thank you so much for joining us today, Kendra.
Thanks for having me.
So we're going to talk about something really interesting. We're going to talk about an initiative called Hockey for Health Heroes. Can you tell us what it is and what it's all about?
Absolutely. So it's a community virtual fundraising event. It was founded by hockey legends Sherwood Basson, Joe Buslow, and Dr. Craig Donaldson. So Dr. Craig Donaldson is actually an emergency doctor at Headwaters, but he is a former OHLer and he played for the Oshawa Generals. So they wanted to come together and they wanted to raise funds and awareness for two community hospitals that mean so much to them, that being Lakeridge Health in Oshawa and Headwaters Healthcare Center here in Orangeville.
Wonderful. So how did the idea come about for them about doing something virtually and how does it work exactly?
Yeah, so obviously with the pandemic, we are unable to host events right now, which is a big fundraising portion at Headwaters. But the reason this event kind of came about, and the launch date especially, so May 13th was the launch date of this event, and that actually marked the 30th anniversary of the Memorial Cup victory for Sherry, Joe, and Dr. Donaldson. So that ultimately inspired the Oshawa Generals alumni to raise support for the communities that helped them to get to where they are today. So that being Oshawa for the Generals and Headwaters for Dr. Donaldson.
So tell us, how does it work? How can people participate? What can we do? What's happening?
Yeah, absolutely. So there's lots of different ways that people can participate. As an individual, you can go online and make a donation to the foundation that they choose. So if you go to www.hockeyforhealthheroes.com, you get a lot of information about the event, and then you have an opportunity to make a donation. So you can make a donation to Lake Ridge Health. You can also make a donation to Headwaters Healthcare Foundation, or you can make a donation to both if you would like as well. And then if you want to get a little bit more active in the fundraising world, you can make a team. So as an individual, you can kind of build your own team if you want to get your hockey buddies together, or your work if you want to set up a team, and then you can share the link to your family and friends to make even more donations. And you can also do that as an individual yourself. You can make up your own fundraising page and share that link to your family and friends in hopes that they will make donations to the event, to the virtual event as well.
So you don't have to be a hockey player to participate. It can be anyone that can create page in efforts to support our local hospital, which I'm hoping some of us will be able to go out there and do for sure.
Absolutely. Yeah, anyone's able to do it.
So is there any other ways that the community can help? Either would it be spreading the word or whatnot?
Absolutely. So you can use the hashtag Hockey for Health Heroes. You can share the event. And if you're able to make a donation, whether that be small or large, it's appreciated. But if you're unable to, which these are hard times for every one of us, so we completely understand if you're not able to do that. So just sharing that link online to your family and friends and let them know that this is happening. It's for a really great cause. And we're just happy that in times like these, when we're unable to do things like play or watch hockey or be in social gatherings, we are still looking to have people kind of gather together virtually and hope to make a difference.
So with regards to the event, I believe that there's some hockey personalities involved. Is there?
Yes, yeah. So we are partnering up with both players currently in the OHL with the help of the Oshawa Generals, as well as we are starting some partnerships with players in the NHL, both current and alumni. Lots of OHL alumni, obviously. This team won the Cup 30 years ago. So all of their families, friends are involved. And we also have some sports announcers that are helping us get the word out as well. Bob McKenzie just shared the event on Twitter for him. So we're very thankful for all of our supporters in helping us share the word for our community hospitals.
And I think that's really important as people realize that where you may not be able to help financially, we're doing this in support of a group of people that are working above and beyond what they normally do during this pandemic, and all of the frontline workers and all of the people that are employed by Headwaters Healthcare and the cleaning staff and the food and the maintenance and the tradespeople. And, we want to support them in any way we can. But even by sharing this information with people, you are doing a wonderful job in supporting the community as well. So please go online and Twitter and Facebook, and if you happen to be on Instagram, just share links, share information, and together we can definitely make a difference for sure. Absolutely. So what happens with the funds where are they directed to when somebody does a donation?
Yeah, so when you make a donation online, you get to choose which foundation you would like to support, so that being Headwaters or Lake Ridge. And once the funds are received, all of those funds are going to help purchase new smart IV pumps for both of the hospitals. So these pumps are critical at hospitals, and they're actually used in almost every department, whether that be surgery, chemotherapy, the ICU, which if COVID patients are staying for long periods of time, generally they are staying in the ICU. So these smart pumps are very important, and they help monitor and administer medication to fluids and fluids into patients. And they're basically drug libraries. They hold all of that information, and they're able to ensure accuracy when patients are using them.
That is phenomenal. So we do hope everyone who can support does, for sure, and create your own page, go online. So can you repeat again the best way for them to get the information about how they can participate?
Yeah, all the information is at www.hockeyforhealthheroes.com. You can get all of the information about the event as well as both of the foundations, and it directs you directly to make the donation.
So working as the coordinator in community and corporate engagement for Headwaters Healthcare, are there other online initiatives that are happening right now, or is it just a general donation with regards to what's happening?
Yeah, so we are trying to figure out what the new normal is as well, just like each and every one of you guys as well. And we are starting to host virtual events. It's becoming more and more common for us. So if you go to our website, which is hhcfoundation.com, under the events section, you'll see all of our signature events that have been pushed until later of the year, hopefully. But you can also scroll down to the bottom and see all of our community events that are happening. Right now, they are all virtual. You can, again, sharing is so big for us right now, just getting the word out there. So if you are unable to make a donation, that's okay. Your way to support is to help us get the word out. So we thank everyone who has done that so far. Right now, we normally this time of year, actually, Center Dufferin District High School and Glenbrook Public School host a Hair Off for Headwaters or a Glenbrook Gives event. And of course, with the school situation right now and the event situation right now, we've actually moved it online. So every year we have some of our board members like to shave their head for this event. So we're still going to do that. They're still going to be shaving their heads in their homes, and we're still looking to raise funds for the oncology department at Headwaters as well. So all of the information on the event and the past amazing work that both of these schools have done can be found on our website. And if you would like to make a donation to our virtual Hair Off for Headwaters, you can do that. And then later on next week, we're going to take videos of both of our board members shaving their heads, and we're going to post that online as well.
Well, you know what? This is actually extremely timely. Hairdressers and barbershops are still closed. Yes. This is your opportunity as a community to raise some funds for our local hospital and our local heroes on the front lines. Because I mean, I know I could definitely use a trim. I'm not going to go. I'm sorry. I can't take it all off. I'm definitely encouraging you. If it's something that you're considering just because your hair is getting too long, everything's happening to, and you can't get your hair cut, this is an amazing opportunity, and film it. I mean, why not? And then post it and tag Headwaters Healthcare and raise some funds, because maybe your friends and family are out there to support you. Shave your head when you wouldn't normally do so. It's really unfortunate. My son just shaved his head. We could have done that as a fundraiser.
No. And really, at any time, you can go onto our website and make that fundraising page. So 100%, if you are getting sick of your long locks and you want to do this and support Headwaters, go online. It's so easy to make your own personal fundraising page. Take a video, post it, tag us. We're definitely going to share it and just kind of put some smile on people's faces right now.
Lay down. Lay down.
Okay.
We were so close.
Oh, goodness.
All right. Okay. I'm so sorry.
Right.
I'm going to lose my brain this morning.
Oh, no.
Yeah. I've got 3 more after this.
Oh, geez.
Okay. All right. So what I can do is we can keep going.
Okay.
But what I'll do is I'll just kind of prompt you and say, going back into creating your own page and doing all that, and then Todd can take it from there.
Absolutely.
Awesome. I'm so sorry.
That's okay.
So how can people participate in the Hairs Off promotion for Headwaters?
Absolutely. So if you are kind of getting sick of your long locks and you are interested in shaving your head, you can go onto our website, hhcfoundation.com. Under the Ways to Give section of our website, you can press Create Your Own Fundraising page. You can add all your details. You can add photos of your crazy hair right now, and then take a video of you shaving your head. It's going to be so fun. If you post it online, make sure you tag Headwaters Healthcare Foundation. We're definitely going to share it, and share the link to your personal fundraising page to your friends and family. And then that way you're going to be able to start fundraising. All of the funds, you can choose where you want the funds to go. You can just contact me and we can have that conversation, see where you want the funds to go, and we can definitely get anyone started.
Absolutely. And if you're going to tag Headwaters Healthcare, please, if you can, tag me in any way, even if you're tagging Dufferin Life, which is a show that I normally do for Rogers. Please do that, and I am happy to share and hopefully help promote as well.
Thank you.
So how long have you been working with Headwaters?
I am actually one of the newest members of the Headwaters Healthcare Foundation team. So I have been there 8 months or so. So it's still very new for me, and it's been such an amazing experience.
So you came in, only 5 months before all of this happened. So it must be a great adjustment for you, helping to find new ways to do things and get the information out and fundraise as well. So with that being said, what have you been doing to remain sane and on those off times that you're not working?
It's been tough, and working from home 90% of the time. It's interesting to find that work-life balance. I have a dog that's actually sitting right here in my lap, and he pretty much makes me sane all of the time. So we go on nice long walks and try to keep as active as possible during times like these. I think that's so important, keeping that activity in your life, but doing it safely.
Wonderful. Kendra, I want to thank you so much for joining us and sharing the information for Hockey for Health Heroes and all of the different fundraising initiatives. And thanks again for coming on the show.
Thank you so much for having me. It's great.
All of you out there, I hope you are remaining safe and healthy. If you want to support Headwaters Healthcare Foundation, please go online and see it in the different ways you can, or please share the information. Until next time, we'll see you soon.
Arrive alive, drive sober.
Joining me today on this Rogers Local Update, we have Sonia McDonald from the Edify Center. She is a certified child and youth counselor. Thank you so much, Sonia, for joining us.
Hi, how are you?
Good. How are you doing?
Good.
So can you start by describing some of the services that the Edify Center provided prior to the COVID-19 pandemic?
Yeah, we opened our center on March 31st of last year. It's kind of been a long project in the making. As you know, I'm a counselor, so I was doing a lot of counseling and also doing a lot of suicide intervention training, mental health education, that type of thing. And so we brought it all together in the center, and we added the physical focus program. So that's why having a nice large space in town was really great. We're right on Broadway, so we do get a lot of walk-in traffic, that kind of thing. So we were offering mental health education, counseling, as well as our physical focus program through boxing. And so those programs were just running along really well. We were working really hard to get new clients all the time. It was really going well. We had huge response in the community. It's been really great.
And how has COVID-19 affected the business and the services that you're able to provide?
Well, sadly, we had to close our doors on March 13th. We ended up making the decision that it was probably safer for not only our team, but for everybody in the community to not come through the door. So we stuck around for a few days trying to reach out to our clients, talking with them about how can we do some things online. We brainstormed, we did a bunch of stuff, and then we decided that it was the best idea to just close. We've been offering during our shutdown, though, doing our best to, get as much mental health education out there as possible online. We've recently started a mental health online support group on Facebook. It's free for anybody to join. We're just kind of getting that up and rolling. We've got a team of some really brilliant social service workers. And we're all taking turns at posting, writing good articles. We started blogging. We started doing a whole bunch of things that we felt we could deliver as a free service in the community.
So let's talk about mental health. Let's start talking. We're going 9 weeks into many of us being either working from home or just being home. Some of us alone, some of us with family, and all different combinations of people in our homes. So let's start talking about how isolation itself affects mental health.
Well, we're seeing a lot of people having much higher instances of stress and anxiety. I think for us, what we're really seeing is in the beginning, people were very scared, and we saw a lot of fear, and we saw a lot of stress and anxiety and panic around finances, and what are we going to do, and how am I not going to go to work? And then as we moved through the first couple of weeks, we saw a lot of frustration, right? People get really frustrated, and that really affects our mental health. And we've seen all these really interesting waves happening. So when people are feeling stress and heightened anxiety, they might not, if they've never experienced it before, they might not recognize that that's what it is. So, being at home, likely sitting in a lot of silence, watching a lot of TV, doing that kind of mindless scrolling on our phones, those kinds of things are really contributing to people doing a lot of what we call overthinking. So it just means we all process information in a different way. And when we sit and we think about all the things in our life that we're worried about, it seems to compile. It's as though our cup's getting fuller and fuller. So we're seeing a lot of that. And then the next kind of wave of that, which is interesting, is we've seen a period where people have kind of stopped for a little while engaging in Facebook. Maybe we're kind of perusing the news instead of reading the news. Anxiety seems to not have dissipated, but stress maybe has. I think people leveled off a little bit with their stress and then started to become bored. And boredom can affect your mental health in the same way. And then recently, when they made the announcement about new businesses opening, we're kind of seeing a peak again. So it's really interesting to watch that wave, not just watch it, but be in it as well, right? Because we're all dealing with our own stuff at home. And yeah.
So if we were, with the people that we have living in our homes or around us and the people that we're keeping in contact, what are some signs that maybe people may not realize, as you mentioned, that they are not coping as well as they think they are? What are some signs to keep an eye out for with our loved ones?
In someone else, like in someone in your home? Yeah. If you're recognizing that someone in your bubble is all of the sudden really short or angry a lot, we see that a lot, right? We get angry when we're struggling with our own stuff. What we think is laziness and unmotivation, like not being motivated, might not have anything to do with that at all. It might have everything to do with our brains are working 10 times faster than they do generally, even though we're not doing it. We're occupying our brain with so much media and so much television and noise around the room that maybe you don't normally have at work, those kinds of things. So agitation is something that people can really watch for. sadness too, like periods of being really quiet and being in your own head and really thinking about all the things that are going on. You might be sitting on the couch next to someone who's being very, very quiet, and you're trying to figure out why they're not talking to you.
Right. And would these be the same traits that we would see in ourselves that maybe we wouldn't recognize? Maybe we would just think, well, you know what, I'm just having a bad day. But when it's continual, would they be the same traits and what we would see in ourselves? Or is there something different that may trigger something as an individual?
So I think in ourselves, it's harder to recognize any of those traits, right? We don't realize that it's been 35 minutes that we've not actually said anything. And in that period of time, we could have had, 1,000 different thoughts, and everybody processes differently. So if you're someone who generally can process things pretty quickly and kind of compartmentalize them and say, okay, here's a problem, here are my multiple solutions, and this is the one I'm going to choose. If you can do that fairly quickly and you start to recognize that you're struggling to pick what solution will work, then that could be an indicator to you that maybe you're experiencing some stress, you're maybe having higher anxiety. Or if you're feeling anxious and you've never really felt that feeling before, and there's really no reason why. So you get out of bed and you make your coffee and you get, why isn't the coffee maker going faster? And, I'm not going to make muffins today because I might burn them. And like, those are the types of thoughts that people get caught up in. So if you're recognizing that in yourself, it's important to look at what are you going to do for your own self-care. And it's also really important to recognize that other people are going through similar things and it might look very different.
I mean, it's okay to have a sad day, right? Like I just don't want to create alarm in people who are like, oh my gosh, I'm sad and I was actually crying, or I had to go for a drive, I was so upset, or whatever it happens to be. That's okay, is it not?
Absolutely. We tell people all the time, it's okay to not be okay. And it's also okay to tell the people that you're isolated with that I'm not having a good day, and say it's not about you. I'm just, we use the word blah at our house. It's just one of those blah days. And we all kind of get what that means. And being able to say that and being able to recognize I need a break. It's hard for us to take those breaks right now because we can't see our friends. We can't go out, and, some people love to go shopping or love to go and have a coffee when they're struggling, or even just sit by themselves somewhere. And right now, we're not allowing people to do that. So that's really tough for people. We've talked a little bit about how do we help people manage that. And there's some really basic things too that you can watch for. Things like you're not sleeping or you're oversleeping. There are some things, maybe you forget to eat. So really pushing yourself to be cognizant of, I need to eat those 3 meals a day. I need to, as much as we joke about everybody's putting on this COVID-19 and eating it done, not everybody is. Some people are sitting around not eating or not getting out of bed till 10, 11 when normally they're up at 6. So watching those types of things.
Sorry. So what tips can we give people to deal with these types of anxieties and stress? And when should they reach out for help?
So I would say that right now we need to really go back to very, very basic self-care. So try and set yourself a routine so that you can go to bed at a decent time and get up at a decent time. It doesn't mean it has to be the same time that you went to work, but it has to be a reasonable time for you. So if now all of a sudden you used to go to bed at 10 and now you go to bed at midnight, well, try and get up at 8 instead of getting up at 6. And, sleeping is super important. Trying to eat your 3 meals a day. Water, we can't say water enough. It is shocking if you are finding yourself really tired and sitting on the couch and just really lethargic. I promise you, having a small, even drink of water will re-energize your brain very quickly. And trying to eat as many good foods as possible. I think that's really important. Getting up and stretching, like getting up and walking around your house, even though sometimes you feel like you're walking around in circles, that's okay. but get up, wander, and we joke about, I went from the couch to the chair today, from the living room to the bedroom, but that's okay too. You want to change that scenery. You want to get up and walk around and stretch, especially if you're working from home. What else?
Yeah, and absolutely. And I think we're still allowed to go out for a walk, right? So there's always the fresh air aspect of it. The nicer weather is on its way. And if it's, but remembering to follow the protocols with regards to physical distancing and hands and all those sort of things are important. But there's no reason why you can't socialize with your neighbor when they're in their backyard and you're in yours if you haven't.
And just yell. Yeah, absolutely.
Absolutely. So when do we reach out? We've just got about a minute or so left. So when do we know, or what should be a trigger point or an indication that we should reach out for a little bit more help?
So regardless whether we're in isolation or, the way it was before, we know that if someone is struggling with their mental health and it's persistent for longer than 2 weeks, then it's something we need to be looking at. So if you're recognizing that this is becoming a pattern, you're having these anxious thoughts, or you're having dark thoughts meaning like, oh, I'm going to lose my job. I'm never going to do this. Never going to get anywhere. If you're finding that those are persistent, start logging them or start writing them down or start telling someone about them, like find a buddy and tell someone. But if you're finding that that's lasting, like around the 2 week mark, you should really be looking at, okay, so maybe I need to reach out to get some help from someone. But I also encourage people, if you see someone struggling, go out of your way right now to reach out to them. And you don't have to be a therapist or a counselor. You just need to reach out to someone and say, hey, how are you doing?
Joining me now is Amanda Davis. She's from Headwaters Pet Food Bank. There we go. I got it all out. Thank you so much for taking the time to speak with us today, Amanda.
Oh, thank you for having me.
Why don't you start by telling us a little bit about the Headwaters Pet Food Bank and the services that you provide?
Okay. We started just under a year ago, last year in June, running it out of our apartment. So within a few months, it got a little crazy. Lots of donations came in. And so we were kind of forced to have a outside storage facility. So what we do is, our goal is to keep pets and families together. So, individuals, families who are struggling financially to meet their own, dietary needs and pay the rent and the bills. Sometimes it's difficult. They can't always afford pet food. So I had been buying it out of my pocket previously. And then someone suggested, why don't you start a charity? You'll get a lot more donations. It'll save you from jumping in the dumpsters outside the pet food stores. So that's what we've done. We advertised on Facebook to begin with, and it went from about 24 people right off the bat to now we're feeding 27 pets each month throughout the Headwaters and like tourism areas. So what's that? Dufferin-County and Caledon.
So that's a very large jump within just about a year. That is incredible. So we're gonna go back a little bit further before we get into what's happening right now. So what motivated you to start this, and from your own pocket to begin with?
Many years ago, from an abusive relationship, but I wouldn't leave till the pets were taken care of. So I had a neighbor on one side, she took in the animals, and the other lady on the other side paid for the animals. And I always swore I'd give back to help people. And there's an awful lot of people, and lots of animals are being dumped. They're being dropped off at the Humane Society. And I just thought there's no need, because you had a life prior to the situation where you need help. So why should you be forced to get rid of your animals? Like, just help out. And I've done dog rescue, Rottweiler rescue for 20 years, and I've seen all kinds. and has my daughter who now works here at a local vet in Orangeville. She sees lots, and she brings a lot of things home. So, and for me, it wasn't, I live a frugal life, so I had some change left over. And if somebody needed help, then I would, offer the help I could, whether it was pay the vet bill, buy the food, take them in. Like we actually foster for people as well who go into the shelters, and the rehab centers. So this is something I've done for years. I'm an animal lover, so.
Well, we definitely, as a community, thank you for that. That is a beautiful thing that you are doing. So let's talk about how COVID-19 has affected the pet food bank.
COVID, we used to load up the van with, my minivan was basically on angel wings. Every time we went, it had 2,000 pounds of dog food or cat food in it. We'd drive to the towns, people would meet us, and we'd provide the food. So we were mobile. Now we can't be. So we work out of our storage unit as a drive-through sort of system. People just come up and they say, hi, I have 2 dogs, 1 cat, 2 hamsters, whatever it is. I go inside to the storage unit where obviously I have a mask and hand sanitizer and gloves, and I get the food that they need, put it in their trunk, wish them well, and then tell them, see you next month, because they're allowed to come once a month. And there's usually some tears and some of those elbow sort of hugs or pretend hugs, because you can't, but every day I do a set of crying. I'm not afraid to admit it, people's stories or their emotions, and they say, well, I brought my friend along, and then I help that person. And we try to do it tailored to the actual animal's age, breed, nutritional sensitivities, whatever that is. So we're just Monday, Wednesday, Thursday at the storage unit. The gates are open and they just file on in, and then they go around the back and go on their way.
Well, let's talk about what types of animals you're able to service, because you mentioned hamsters there, which didn't even dawn on me. I was thinking, streamlined cats, dogs, that sort of thing.
Well, we started, that's exactly what I was doing in the beginning. And a couple of parrots, right? Like when I was actually dumpster diving. And then now we cover, let's see, on the shelf is tadpole, betta fish, hamster, gerbil, guinea pig, rabbit, so all your little small bedding animals and their bedding, dog, cat. I was asked to get some kind of grubby worms for like a dragon of some sort, and I had no clue. I just said, sorry, I can give you the bedding, I can give you the tank, because we get donated a lot of supplies, so including, blankets and crates and leashes and lots of teddy bears for the dogs, but we basically cover from A to Z. If it's a domesticated animal, as long as I don't have to pick up the worm things, I'm good. We'll cover everything.
Well, you know what? I don't blame you. I'm not quite sure. That's a little more exotic than I think I would go.
I wouldn't even know where to buy them to begin with, to be honest, right? I have no clue.
Wonderful. So have you seen an increase in the need for pet food since the coronavirus has taken place?
Yes. In the beginning, not so much, because people had a stockpile, maybe a little bit of money. But I get about a dozen new queries or new clients, a combination of each week that it's been going on. And I get people come, I got a query the other day from Keswick. And I said, if you're willing to come to me, I'll give you 2 months worth of supplies. Right. So, it's Keswick and Acton, all the way around outside of Dufferin-County. We even service Guelph now because the need has gone up so great.
Wow, that is phenomenal. And I'm thinking yes, but do you anticipate that this is going to continue to rise? I think even after the bulk of COVID-19 and the coronavirus, and when we get to the other side, do you think it's going to stay on an increasing level?
COVID, more people are talking about it. So, and there are very few pet food banks. There's one in Kitchener-Waterloo. There is one in Whitby that covers Whitby and Oshawa, out in Durham region. Before COVID, I was in chit chat with York Region and a gentleman in Simcoe County just to expand out there. I don't see it going down anytime soon.
So Amanda, do you have a need for volunteers?
Yes, we do. When we do the donation drives, for example, we'll have a truck full of pet food and supplies that we will need to put into the storage facility. Also at the actual locations, wherever we decide to do the donation drives, we'll need volunteers there. Plus, we also need people to help pick up, say, the private donations. For example, if you have, a bag of dog food, cat food you buy, and your pet decides, nope, don't want to eat it anymore, you probably could take it back to the store, but during COVID, there's no such thing as refunds, right? So a lot of people will leave it on their porch, text me and tell me that they have, whichever product it is, and we go pick it up, because we do take open bags as well, especially if it's veterinary food. That stuff's very expensive. So, and volunteers to maybe kind of do like a fundraising campaign. Maybe they work at a big big employer, and they could do donation drives, fundraising drives, in forms of bake sales or just asking people to donate, that sort of thing. We're looking to help spread the word that we're here and what we provide, even though we have grown quite big, quite fast.
With regards to donations, is there a donation drop area that they can do, or is it better to contact you directly?
I would say at the moment it's better to contact me. Prior to the COVID, in each town, I had a specific place with a donation bin, a storage tote of types. But I would say at the moment it would be better to contact me.
Okay, and what's the best way for people to get a hold of you?
Calling or text.
And what's the number that they should call?
519-288-3500.
Wonderful. We live in a wonderful community, so hopefully we are helping to spread the word, and people will be able to help in any way they can. And even if it's a matter of, collecting donations from others, it's a wonderful thing to be able to keep your pets in your home, especially when you're having a trying time. And we're all in stressful times that are causing a lot of anxiety right now with the coronavirus and people losing their jobs and being unsure of what's happening in the future. So,
or even those isolated, it's good that they have that ability.
Absolutely. So you've been doing this for about a year. So obviously and you said that you were fostering before that. So obviously you're a big lover of animals.
Yeah.
So I'm just going to ask out of curiosity, has there ever been a time where you've been somewhat overrun in your own home with the animals that you take in?
Oh, yes. When I don't know how to say no to a dog that needs fostering, especially when I'm breed specific, right? So for me, it's Rottweilers. So when we lived on a farm a year ago, I had 12 of them. Yes, and they've all been adopted out, and that included our own too. So in reality, it was just 10, right? So it's been that way always, and my kids have always brought home animals. So from birds to cats to lizard, gecko things. But right now we're down to one dog in this apartment, and it's peaceful. But I don't know how to say no. That's the thing. If it needs me, I will help. Whether it's vet care, going out in the middle of the night to, we get crazy calls. I just saw a dog, it's been hit. So we go out, my daughter and I, and then we take it to the vets, take care of it overnight, pay the boarding fees or whatever. Or we're crazy enough to bring it home. I don't know how to say no.
Well, thank you for all that you do. And I think that's absolutely fabulous that you have the ability to do it, and that the community is helping and will hopefully help some more. Amanda Davis from Headwaters Pet Food Bank. I don't know why I'm having that pause there. Pet Food Bank. Thank you so much for joining us today and sharing the word.
Okay, thanks for having me.